Afternoon, everyone. Yes. There, is that better? There we go. Yes, maybe. You'll have to do it when you get up here in a minute. Excuse us. Good afternoon, everyone. We are thrilled that you are here to celebrate the midpoint success of your family members and friends. And so if you would, smile broadly and clap as they come in and take their seats, and then we will get started. Welcome again. And whoever has to sit behind Zach, I'm sorry we didn't fix that seating a little better. My apologies. My name is Wendy Chase. I am the program director for the MS MedSLP program. These lovely young people, all younger than me, that makes them young, have worked really, really hard, and we are here to celebrate that accomplishment tonight. So we have lots of words of wisdom for you to listen to from a variety of individuals, which we will get to in just a moment. However, as we get started tonight, I want to set the tone for this evening by reminding you all that we are very thankful that you are here. We are very thankful that you are here. We know that success for these people doesn't happen without a support system. And you are that support system. So thank you very much for being who you are and providing the things that these folks need to succeed in this program. Your role in this journey is incalculable. As we look ahead, we are acknowledging that there's still more work to do, though. So your job is not done. You're in it for the long haul with us. Together we will make it work. Your family members and friends will work hard, as will we. That is a commitment that we make as a faculty and a university to this group of individuals. And we know they're going to rely on you again as they go through lots of interesting challenges coming up in the next year. All right, before we go too much further, please meet the faculty for the MS MedSLP program. So starting at the end, we have Ms. Kristen Ipsen. Our Director of Clinical Education is Ms. Elby Stonier. Next up, from Missouri, less than a year ago, we have Lauren Seamers. Dr. Koloff, who has promised that the contractions have stopped temporarily, is next. News we will check in on repeatedly throughout the evening. Next up, we have Dr. Sectum. Clearly a crowd favorite. Over here, however, we have two staff members that support this program in ways that not enough people will ever appreciate. So first of all, we have Ms. Lauren Murray, who is the Clinical Placement Coordinator, responsible for finding a place for everyone to be next year. And then next to her, we have our program coordinator and administrative assistant, Sasha Herget, who really knows everything. So we are very thankful to them. We also have two very honored guests with us here to celebrate your accomplishments this evening. First, I'd like to introduce Dean Lau of the College of Rehabilitation Sciences. Thank you for coming. And then we're going to go to the president and CEO of the university, who made time in his busy schedule and many, many commitments to come and also share in acknowledging what you have accomplished. I want you to feel very, very good about that. And he has a few words to share with you first. So please, President Martin.
Like all good leaders, Wendy forgot to mention herself as an honored and esteemed faculty member. Yes. She's a great leader. As you would just attested through clapping, you could have booed her, all right? But so I'm glad you didn't. No. I think this is great. This is a good omen. Yeah. But thank you. This really is a wonderful time. This is an inflection point, right? A moment to just breathe, appreciate where you've been, and celebrate that success of getting to this point without panicking about what's next. It will come, and you'll be just fine. But I'm glad, I love the white coat ceremony, because it is that moment of reflection and a point of energy to propel you forward. And I do appreciate the good works of your faculty and those who support you, including those who are here. Now, I know that Wendy acknowledged them, but you know what? They need to hear from you, our students. Will you stand and turn, point, whatever it is to your family and friends. I rode an elevator up with this fine young man today, and just say thank you. Let them hear it. Turn, stand, come on. Say thank you, show it. They truly are your support system that enables you to have the moment or the opportunity to study and to become the great speech pathologist that you are destined to be. And thank you for choosing this profession, by the way. You know, you could have chosen to be anything, and you chose this profession. And I'm sure from whatever reason you had experiences that led you to this point, and I'm grateful for those, because we need individuals, clinicians, experts like you are in training to become, to help people in their greatest moment of need. Odds are, some people have never heard of what a speech language pathologist, right? Or a MS, MedSLP, what does that alphabet soup mean? But when they have a moment because of an experience, an accident, or just something happened within their own body because of aging or what have you, then they get to know what it is that you do. Then they are grateful for the skills that you have dedicated yourself to learning so that you can help them in that moment of need. Now, there are 5 things I would like you to remember today. Most people, we've been told that they can only remember 3 things. But we're not most people, you're RMU students. You can handle 5 things, correct? Yes, all right, I like that. All right, that confidence, that's what we need. The first one I'd like you to remember is why you're here. I alluded to that just a moment ago, but what was it? What did you put down on your essay? Why you wanted to go to this program and learn this skill from this esteemed faculty? What is your why, if you will? Remember that, because there'll be moments where you're going to, oh man, really? And yes, you have to remind yourself of that why. That grounds you, and it will yet evolve as your experiences change. You'll say, oh, this is also a reason why I want to be a speech-language pathologist. To remember that is powerful, especially in the moments where you just want to throw in the towel. But what was unique about your why is you, yourself. So be yourself. Part of your why, if you will, of why you want to be speech language pathologist is because of who you are, and to appreciate that and what you bring to the equation. You'll see things, as I'm sure you've noticed, differently than your classmates see things. Appreciate that, okay? The first one, remember your why. The second one is to remember what it's like to be a patient, right? We've all seen clinicians of one kind or another, and those that really take the time to see you, to listen to you, to be present, are those you remember. They are those who really, truly lift those in that time of need. So remember what it's like to be a patient. It may be your 20th person that you're seeing in that day, but it's their first time with you. And appreciating that moment is powerful, and it is what you make it to be. So be present. The third is to trust your training. Your faculty have pushed you, and rightly so that you have the confidence as you go out into the clinical world to face the challenges that will come to you. Trust your training, including, wait, I don't know, so I'm not going to make something up. I'm going to take a breather and say, let me look into that, and I'll get back to you. And then you got to phone a friend, right, with any of the faculty. Apparently, by the volume of cheers, you're calling Phil first. But his number is 555-555-5555. But trust that training. And part of that training is to be humble. You have been equipped with the knowledge, and yet you are still yet learning. So you know what you bring to the equation, but also be humble enough to learn from your patients, to learn from those you'll be working with, and to continue to learn from your faculty. Grow, and that humility is power. It's not gee willy, no, it is confidence of what you do know and a willingness to share it and to learn from others what they know to become the clinician you're destined to be. So that's number 3. Now, number 4 is to remember to say thank you. Say thank you to your patient. Help them feel that you are present with them and that it's an honor to help them. To say thank you to your support network, and even the support network to the patients that you'll see. Thank you for listening. Thank you for being present with you in that moment. Gratitude is a powerful, powerful movement and energy that I often think we forget too frequently about. So be thankful, all right? You got these things, right? I said 4, I said 5, and I've given you 4. What's the first one? Your why. Second, what it's like to be a patient, all right? The third, call Phil, yeah? 1-800, call Phil. No, trust your training, all right? And then the fourth one, gratitude. Remember to say thank you. Now, the fifth one is I want you to look at the program or at the emblem on your white coat. Do you see the shield? Embedded in the shield is a hand. Remember, that is your hand. You have chosen to come to Rocky Mountain University of Health Professions, where we have a focus on advancing the efficacy of healthcare and training clinicians with the purpose to improve the human condition, to help those in need. And we do that by loving and lifting them. To love someone is to see them for who they are, to meet them where they are, and to listen to what they say. You do those 3 things, you show that love, you'll be able to lift them in ways others who neglect one, if not all of those 3 elements, cannot do. That's your hand. You are ambassadors of this institution. We encourage you to, and as such, you wear that banner with pride, knowing you have been trained, pushed, and you have the confidence to be the speech language pathologist that you want to be and are destined to becoming. That's your hand. That is your hand that loves and lifts those in need. So thank you for, again, choosing this wonderful profession. It's hard, but it's so necessary, especially in those moments that are so tender, when you help someone overcome something or learn how to manage something that they didn't choose to have, but they chose you to help deal with it. So thank you. Congratulations. Go out to this at this next phase of your clinical rotations and just do what you know you can do. Be yourself. Be humble. And remember, 1-800-CALL-PHIL. Thank you.
Thank you, President Martin. I think I don't need to say much about Dr. Phil. He's up next. So I am tingling with anticipation for the words of wisdom that he will share with you all. Please welcome your student-elected speaker, Dr. Phil Sectum.
Just remember, you asked for this. I'm going to pull out my phone just in case. All right. So I have everything all written out, but I'm kind of, off the cuff and back and forth. So bear with me. And I know if I have trouble speaking, I'm in a good place because there's a lot of good therapists around here to help out. Good afternoon, President Martin, Dean Lau, the MS MedSLP faculty and staff, family and friends, and most importantly, the graduate students of Cohort 8. Welcome to the Ivory Room, where those of us from the university feel right at home, while being away from our ivory tower. Today, we're here to celebrate real-world impact, not just lofty ideas. We're more about wisdom and compassion than just the color of these walls. There was definitely excitement in the air today as we approached this ceremony in class this morning. I must admit the students had a little more difficulty than usual focusing in on the lecture and the videos that were being shown. Now, I didn't monitor their computers or their devices, but I can only imagine the sidebar chats about last-minute preparations for the white coat. Things like shopping online at like Amazon or Kohl's for last-minute things. All the beautification processes that needed to go on, and all of those different things. Zach, though, he seemed to be most engaged this morning. I noticed he was really, really engaged, so appreciate that, Zach. And honestly, I was very shocked when I ended class about 15 minutes early. What I thought would be a typical ending was met with gasps of relief across the room. And it looks like I might have to repeat that lecture again next week with maybe a pop quiz, okay? Just kidding. Maybe I'll announce a quiz. I also heard excitement that family and friends are here today, and honestly, that frightened me a bit because now I know I have to be on my best behavior. I don't know how well I'm doing at that. I even brought this concern to a few students, and they were like, "Don't worry, Dr. Sectum, just be yourself." So, anyways. I also understand that many of you have dinner reservations, so I'll do my best to keep the speech to about an hour. No, I'll try, I promise. But if it does go a little long, I do have some Slim Jims and baskets of chocolate and granola bars that I can share with everybody from the clinic and from the office. My low-carb diet is not going well. So I want to thank the class for selecting me as your keynote speaker. Honestly, I'm still trying to figure out how I got so lucky. I think it's because I promised not to tell any embarrassing stories. You know, like when somebody passes out in the cadaver lab. Or when somebody asks Dr. Crosley, the professor in the cadaver lab, "Hey, Dr. Crosley, why do these cadavers have the best view of Provo?" And Dr. Crosley, without missing a beat, says, well, why shouldn't they? So, and true, they've donated themselves to science, and so they should have the best view. Or how about saying, I'm sorry when you gag somebody with an endoscope? All the students know that I don't allow I'm sorry, the phrase I'm sorry, in practice sessions because we're trying to learn how to help people, and it's just a part of the process along the way. But I still hear I'm sorry all the time, and I'm starting to wonder if I need to start deducting points for that. Okay, and my favorite, my all-time favorite, when finally the vocal folds come into view, somebody's passing the scope, and then I hear, what a great set of vocal folds. And I'm thinking, wow, I've never heard that before. So, with comments like these, you would think the rigor of our program suffers, but on the contrary, we do have a truly rigorous program, but there are a lot of unforgettable moments that bond us together. Speaking of unforgettable moments, I'm truly honored to be here today to celebrate such an inspiring group of future professionals. Thank you for trusting me to share this special moment with you. As you know, I always come prepared for any situation. So I brought my industrial flashlight. I wasn't sure about how the lighting was going to be. I wanted to make sure I had that base covered. I brought a few tongue depressors. We're covered if anybody needs a swallowing evaluation, and I'm going to count on you all to do the cranial nerve oral mech exam. I got to grab a drink. I'm practicing what I preach with the voice, drinking plenty of water. Today marks a significant milestone, a moment of pride, reflection, and anticipation. Soon, it will really be the first, second, or third day of your externship. Remember in class? And your journey will begin. You'll begin getting consultations to work with all kinds of clients and care team members. Your days with working with Manny Quinn are numbered, okay? In that context, I want to start a story, one that stayed with me since the beginning, a story that captures the essence of what it truly means to be a caregiver, a lifelong learner, and someone who makes a difference. I vividly remember my first experience working with a patient in the hospital after my CFY year, but during my first year in the hospital. Her name was Lily, and she was in room 323, and I still see her face in my mind's eye, and I recall reviewing her chart, reading about her stroke and her aphasia, and then standing in the hallway, staring at her closed door and room number, feeling a mixture of excitement, but also some fear. And I hesitated, standing there, unsure if I was ready to walk through that door. I thought, well, this is crazy. I've got my degree. I've been through the CFY. And now I'm having some hesitation here to go solo, really, truly solo, with my first patient in this new job. It was a moment of trauma and drama, okay? But I took that first step, and in doing so, I crossed a threshold that would solidify my course as a medical SLP. That doorway and that moment of uncertainty became the gateway to a journey of purpose and service. I didn't realize it at the time, but that first step was the beginning of my path as a medical speech-language pathologist. It taught me that moments of doubt and hesitation are often the very things that push us the most, because in those moments we discover what truly matters, helping others, making a difference, and finding our purpose. I also remember in my early days as a clinician, there were mornings when I'd hear the alarm clock and I'd think, oh, I don't want to get up today. Maybe you all could relate somehow. I don't want to go in there today. I was probably overwhelmed by my current caseload, some of the complexities of my patients, their challenges and needs. And I questioned if I had what it took to make a difference. But then I realized even experts once were beginners. The key is showing up, practicing, and trusting that growth will follow. The other key, and this is the most important one, is that it's not about me. It's about those that I can help. Grab another water. Like Lily's room, that first step was the start of something much bigger. And I'd be lying if I said I haven't faced moments so challenging I almost wanted to quit. I once told you all about the patient that coded on me in a swallow study. She was so frail. Back then, I started my studies with a bite of pudding, and she was so frail that the pudding became lodged within the vocal folds. And she wasn't able to push air in or out. And I was shaken. They called a code blue. I slipped off into the corner and was just kind of terrified at what was going on. But the kicker was when they found her chart, it had the letters D and R on the front of it. And I've always kind of wondered if they found that chart after they rescued her. And I've always wondered what would have kind of happened in that moment had they had that chart there. So yeah, it was a traumatic moment, but with guidance from an excellent department director, I learned that sometimes clinically things happen that are beyond your control. And the doctors order these procedures for patients, and we have to remember that. So I was trying to give the doctor the information they needed so that they could do what they needed to do to help this patient. And in the process, I learned that I can say, hey, this patient's not ready for a swallowing evaluation. And so I learned from that and moved forward. These moments can become strengths, benefiting both you and your clients as you move forward. As I've said to some of you that I've supervised, I say there's no such thing as a bad session. And what I mean by that is because you're always learning. Whatever happens, there's something to be gained from that. Now, the other supervisors may have a different view or a different definition of what a bad session is. I will leave it to them to inform you of that. So I also had some humorous moments. I once was so focused on passing an endoscope during a vocal cord surgery that I lost track where the scope was. I couldn't see on the monitor what I was supposed to be seeing inside of the patient. And I was getting frantic, and I looked over at the surgeon who had his hands busy, and I said, Dr. Shaw, where's the scope? Can you give me a suggestion? And without missing a beat, he said, well, Phil, you just herniated the brain. And I'm like this. Turns out he was joking, much to my happiness. You try to stay calm in those moments where things kind of happen that are unexpected. And then there were the most rewarding times when I worked with patients who had lost their voices permanently due to throat cancer, who had a procedure known as a total laryngectomy. Before the surgery, it was our job to go in and do a pre-op visit to get them prepared for what the outcome was going to be. But it never really hit home for them until after the surgery. And though I could never really know what it was like, I always wondered about their feelings and emotions when they woke up from the surgery, when they realized that their voice was gone forever. A key piece of their identity was gone forever. And they could not speak, they could not laugh, and they could not cry. So I can't imagine a moment so frightening as to call for a nurse due to a pain or some need, and there is nothing but silence. But during the follow-up post office visits, as a speech-language pathologist, we are able to help. I was able to help them establish new methods and ways to speak and communicate. And in all cases, and I stress the word all, at least the ones that I was seeing, these people went on to lead normal lives and return to work, family, and social gatherings. Now, seeing these people engage in conversation and gatherings again also made me realize why I chose this profession. So, I'm just about a fourth of the way done. Just kidding. Today, I want to ask you, who are your patients? And more importantly, who are you to your patients? Are you a professional? Are you competent? Are you confident? Do you provide evidence-based, person-centered care? Are you compassionate, truly caring for the individual in front of you? Are you kind, flexible, curious, authentic? Remember, your patients are not just the people sitting in your therapy room or in a hospital bed. They are living with their communication and swallowing disorders every day, 24/7, 365 days a year. That's the real work, the ongoing effort to help support and empower. And it's that effort that separates good therapy from truly impactful care. I hope you never let anything get in the way of truly impactful care. Again, as I was a young clinician, I often felt overwhelmed, the complexity of the cases, and unsure of myself. Maybe you have felt some of those same things. It's my sincere hope and expectation that because of the stellar education and training you've received in this program at RMU, moments of fear and frustration will be less frequent and less overwhelming than they might have been otherwise. When I compare my graduate school experience to what you've accomplished, I realize I could have really benefited from all the resources that you've had. Extensive time in the cadaver lab, simulation-based learning events, hands-on labs, and real clinical experience. And I certainly would have appreciated the dedication and mentorship and expertise of faculty who have shaped this program and you into something truly exceptional. You see, we were all accomplished and experienced clinicians before returning to this academic setting. And I think that's kind of a strength to kind of help get people where they need to go, you all where you need to go. All of this preparation has set you up tremendously for continued growth, competence, and confidence. And I believe when working alongside graduates from other programs, you will find you have a real edge. Because your education has been thorough, hands-on, and designed to prepare you for real-world applications. You're not just learning, you're gaining the tools to excel, to adapt, and to serve your patients with expertise, compassion, and to be a valuable care team member and an asset for any facility wise enough to hire you. And here's the thought. Recently, during our endoscopy boot camp, the students, there were some pictures, the students made a t-shirt that asked, "What would Dr. Sectum do?" And I was like, what? And my wife was so excited, she requested one, and now she wears it everywhere we go. Family and friends are perplexed. They say, "Isn't this Phil, the guy that just likes to watch TV, go fishing, ride his bike, go to the dog park?" People at restaurants, they're dumbfounded. Who's this Dr. Sectum, you know? Perhaps the shirt will catch on and they'll even sell it at Walmart. Maybe it will be embroidered onto your white coats one day. The possibilities are endless. But that's quite something. Students thinking of me in this way, I know that I'm still a work in progress. But it also made me reflect on the mentors and colleagues along my journey. Because I asked the same thing of them. What would they do? And I realized, and I pondered that, and I think the question we all should be asking is, what did they do? Okay? They showed up, they practiced, they learned, they continually sought to better themselves. I've even donated my nose and mouth, literally, so that you students could eventually pass those endoscopes and diagnose voice and swallowing disorders. I must say, my nose may never walk again. As we progress through this ceremony, the white coat is more than just a piece of clothing. It's a symbol of your commitment to a noble profession. And the purpose of this ceremony is to mark a significant milestone in your journey. It symbolizes the transition from classroom learning to clinical practice, where you will serve and care for others. More than anything, it's an invitation to embody the qualities of a true professional, to embrace the responsibilities that come with caring for people at their most vulnerable, and to foster a sense of community among your colleagues, faculty, and families. The white coat is a symbol of trust placed in you and of the impact you will have on the lives of your patients. It's a reminder that as future SLPs, you are part of something bigger, an ongoing commitment to service growth, and making a difference. And now your externships and placements await. They are your opportunity to demonstrate the lessons from year one, to reflect, to act, to grow, and to serve at a higher level. Please remember all the skills, values, and lessons you've gained, and continue to build on them, because your actions, what you do, will shape your future as a therapist, as a colleague, and a person who makes an impact. And so I leave you with these 3 key points as you don your white coats. Remember Lily's door, that it's not about me, and keep asking, who am I to my clients or my patients? Ultimately, you are a care team member who will help to restore function, increase hope, and strategize to lessen the consequences of their conditions. Best wishes, and I look forward to seeing you on the other side near graduation. I've got my phone number.
Thank you, Dr. Sectum. Pardon me while we come down just a little bit. As a group, the students have also selected a student, a colleague, a peer, a survivor of the MS MedSLP program first year experience to speak to you all with some recollections, some words of wisdom as well, and some hopefully enthusiasm for what will be the next chapter. So please welcome Sarah Kay.
Hello, it is a pleasure to be here today. I am so excited. My cohort knows I love to present, so I am so honored to be here. Good afternoon, everyone. It's an honor and honestly a surreal moment to be standing here today, soon to be wearing a white coat that still smells of new polyester and a little bit of nerves. On behalf of my amazing cohort, we want to thank you for being here today, for joining us and celebrating us. Today, it's more than a milestone. It's an official turning point where an imposter syndrome is imposter no more. Where we transition from, is this in our scope of practice, to what's the evidence-based practice, and I need to call my clinical supervisor. Let's be honest, this journey has not been a gentle stroll. It's been more of a winding hike, an uphill climb, up Mount Stupid, a few wrong turns, and an occasional wild animal in front of us in the form of a cumulative final or a crazy soap note. But together we made it. We sat through our first cranial nerve exam, hands shaking. We ran our first fees with our hands trembling and desperately trying not to shake or say, oops, I'm sorry. We survived the cadaver lab, which taught us way more than muscles and nerves, but how important it is not to lock our knees. It gave us a raw look into the human body. We faced simulations that were with actors that were so convincing we were apologizing to mannequins. We found ourselves evaluating each other's swallow during lunch, but most importantly, hyping each other up for that next endeavor. We've been in the trenches of academia and came out on the other side. We've asked each other questions. Is this an upper motor neuron problem or a lower motor neuron problem? Should I chart that? We rate our days 1 through 10. We compare our moods to ice cream flavors and body parts. Dr. Sectum has prepared us for, you're on your 3rd day of externship, and you walk into the room. We've grown so close that I could recognize the sound of my classmates typing or the sigh that we're giving when we read those exam questions. But truly, what has made this journey remarkable is not what we learned, but who we've become. We're not just students anymore. We're clinicians in training. We're problem solvers, advocates, empathetic listeners. We are beginning to embody the balance of science and heart that defines our field. To our friends and family, thank you. You endured our late night rants about motor speech and dysphagia, let us practice oral mech exams on you, and cheered us on even when you didn't know what we were doing. You reminded us of our strengths on our hard days and celebrated us on our good ones. To our faculty and supervisors, thank you for your wisdom, your patience, and your incredibly detailed feedback. You not only taught us the material, you modeled what it meant to be ethical, compassionate, and lifelong learners. You held us to a high standard and helped us reach them even when we didn't believe we could. You helped us find our clinical voice, even when all we could say was, let me go check that chart. And to my cohort, what a ride. We've laughed, we've cried, we've vented, but most importantly, we survived together. We've carried each other through tough sessions and tougher semesters. Some of us came into this program knowing exactly what we wanted to do. Others, we found our path along the way, often in the middle of a messy clinical or a perfectly timed breakthrough with that client. As we step into this next chapter, these white coats don't just represent knowledge. They represent responsibility. They represent advocacy. They represent trust. Trust that when we will walk into rooms where people are vulnerable, afraid, or struggling, and we will show up and listen. We will listen deeply and do our very best to help them reclaim their voice, their swallow, their communication. We'll meet patients who don't know what SLPs do. We'll be the calm in their chaos, the support in their silence, and that person with the clipboard who's always listening. And yes, we'll make mistakes. We'll second guess our clinical judgment, but we'll learn, we'll grow, and we'll always carry this foundation with us. So today, let's pause and take a moment to breathe, realize what we're at, we finally made it, and honor how far we've come. To look ahead with courage, these white coats might be lightweight in fabric, but they are heavy with purpose. Let's wear them with pride, and let's wear them knowing that every assessment, every plan of care, every moment we show up, there's a cohort, a village, and a calling that brought us all here. Congratulations. Here's to the next chapter.
Thank you, Sarah Kay. What else? They know what that means. All right. Sasha? Did we lose Sasha? Oh, I was hoping you were going to say the names for us. But because doing that and the coats at the same time is a little bit hard, but that's all right. We'll make it work. All right? So you're good. You're good. You do your thing. We are now going to go ahead and work our students through the coding ceremony. And I would like Ms. Ipson and Ms. Stonier to please step forward first and run the first round. I will go ahead and try very hard to say the correct name for the person involved. All right. Cheering, clapping, woo-hooing, all acceptable. Jumping on the chairs, not. So there you have the decorum expected. All right. Are we ready? We'd like to start with Natasha Bateman. Next, we have Rachel Brown. And coming to a stage near you, Katie Baxter. Next to be coded is Kylie Crook. And then it's Ariana Domingo. The next candidate is Kira Estrada. And then there's Timber Hughes. Next, we have Aubrey, very recently Jameson. Belle Jessup, come on down. And then Olivia Johnson. Welcome to the front row, Lindley Kloos. Congratulations. And then, of course, Lizzie Lehman. Lizzie. Then we have Leslie LeBaron. Is that to make up for her being quiet in class? And now we have Aditi Rao. You need to add buttons to the curriculum. Please welcome McKenna Marks. And then there's Carly Meyer. Come on down, Aubrey Publico. Next is Jordan Pearson. Next, we have Desi Pitts, and at times like these, I think we should use her full name, Destiny. Stroll on over, Kylie Ray. And then Jenna Redmond. Jenna, did you rent a bus for these people? And then there was Zach Reed. And then there was Megan Singson. Rounding out this very esteemed class is Sarah Kay once again. That would be Sarah Kay Swanson. I am at fault for never using her actual last name. I'd like to invite Jordan Pearson, who apparently has graduated to the degree of doctor, as written in the program. I didn't even notice that happening. Yeah, no, you've been studying on the side, I know. Well done. To come and lead the group through the student oath.
Please stand, Cohort 8. Okay, so we're just gonna kind of read it together, okay? I'm gonna wait just a second for Kylie Ray to be, all right? Okay. As I continue my journey towards becoming a speech-language pathologist, I pledge to uphold the highest standards of clinical care. I commit to honoring the autonomy and dignity of every person I serve, to listen with empathy, to communicate honestly, and to treat each individual with respect. I vow to serve with beneficence, always acting in the best interest of my patients. I will strive for justice to ensure equitable access to care across all communities. I promise to protect confidentiality, to preserve trust, and to support my patients through both moments of vulnerability and strength. I will continue to learn from my peers and advocate for those whose voices may go unheard. I embrace my responsibility to advance our field, to question, to learn, to grow, and to elevate the standard of care. With humility, integrity, and compassion, I take this oath not only as a future speech-language pathologist, but as a caring leader, critical thinker, unwavering advocate for the lives we are entrusted to serve.
This group also has a cohort mission. Kira Estrada, would you come up and lead that? Oh, you moved.
Thank you. The mission of the Medical Speech-Language Pathology program is to nurture a community of compassionate clinicians and dedicated advocates who understand that communication is only the beginning. We work to restore autonomy, strength, connection, and support growth across every stage of life. We are committed to a holistic, person-centered care that honors lived experiences, strengths, and goals that we serve. In every session, we bring empathy. In every plan, we seek dignity. And in every interaction, we recognize and respect the resilience of human spirit. To be a speech-language pathologist is to stand at an intersection of science and heart, to empower individuals in expressing themselves, reconnecting with others, and participating fully in their lives. Our work is found in quiet milestones, thought clearly expressed, a shared laugh, a regained sense of independence. We are lifelong learners and collaborative partners. We grow through reflection, innovation, and interdisciplinary teamwork. We value equity and cultural humanity and access, knowing that it's our responsibility extends beyond the therapy room. Above all, we believe in the power of connection, not just to people, but within communities and among ourselves as future professionals. That connection is what grounds us, motivates us, and carries us forward. Speech-language pathology is more than a profession. It's a calling to advocate, uplift, and to make lasting differences through communication and beyond. Thank you.
When I listen to the students professing those goals and attitudes as they go forward, I know that we are in good hands for the future. I appreciate how much work you all have put into this, and I want to remind you of one thing as you go away from our ever-hovering selves in your lives, that you are in a position still to have the right to education. We talked about this at your final group meetings. You have the right to go into these experiences as a learner. Yes, a professional, but also still a learner. Take advantage, push yourselves, ask what else. For everyone, thank you again for coming to support your family members and friends. You are an invaluable part of the success that these people will feel as they continue through their journey. And we would love to offer you some cookies. So I'm going to ask the students to please come to the front of the class, in front of the signs down here, so we can get some group photos of you all. And the rest of you, one last round of applause as we watch them gather.